Great.
Good afternoon, everybody. This is Michael Case. I'm the Bureau Chief for the Bureau of Developmental Disability Services here in the Division of Medicaid. We want to welcome you to today's meeting to discuss the upcoming budget and eligibility notice changes. As you know, we are getting ready to implement the new resource allocation model. And of course, with that, we have to change our budget notices as well. So we apologize for the short notice on the announcement for this meeting, but things are moving very, very quickly and there is a lot of work being completed. So we appreciate your patience and we appreciate you being with us here today. I'm going to go ahead and turn the time over to Karen Westbrook, who's a policy manager within the division here, policy program manager, and she has done quite a bit of work with the new resource allocation model. And so she is really the best one to help walk us through the new notices. And she's going to give us some direction on how we can give comments and ask questions during this presentation as well. So Karen?
Great. Thank you, Michael. Okay, everyone. So today we're going to be talking about the upcoming budget and eligibility notice changes. We're going to go through kind of a group of slides at a time, and then we'll pause kind of periodically throughout the presentation to ask if anyone has any questions or anything they need to follow up on and that sort of thing, to make sure everybody is kind of tracking along with the presentation. This is a 2-hour meeting, so towards the middle of the meeting, we will go ahead and we'll probably take a longer break just so people can step away from their computer for maybe 10 minutes or so. So know that break is going to be coming in there as well. Throughout the presentation, if you have questions and you want to write those questions into the chat box, you can send us your questions through the chat anytime during the presentation. And again, like I said, we'll pause periodically to check for understanding and to answer questions. If you would prefer to speak your question, if you can hit the raise your hand button on the chat, and then we'll be able to call on you to ask your question, to speak your question.
And Karen, I am going to interrupt just for a second here and ask people to please use the chat box if you can, rather than the Q&A box. It just helps with the recording process to have it all in one place. We will capture the Q&A as well, but it is much more functional for us if you use the chat box if you can.
Great.
And I saw a few questions come through, Karen, in the Q&A so far. So just so folks know, we are recording this meeting, and we will also be recording the meeting that's happening tomorrow in Spanish. So these slides and those recordings will be made available for folks to reference if needed.
Thank you, Alina. And I should have introduced Alina at the beginning as well. Alina Vasquez is with Human Services Research Institute. I have to think about that before because I'm so used to just saying HSRI, and has been helping us with this entire process. And she will be providing information with Karen today as well. And I will address those questions that are in the Q&A box now as you two proceed with the presentation.
Okay, great. Thank you so much. Let me get everything set here. All right. So I want to talk through briefly about kind of what we're going to be discussing today. So the purpose of the presentation is to review the upcoming changes to the adult DD program notices. Important to realize, like, again, this is just the adult DD program. We won't be discussing notices or that sort of thing that apply to the children's program here. And so what we'd like to do is we'll kind of talk through some of the upcoming changes. We'll provide some kind of general examples of language that we use, that we're planning on using in the notices. We'll kind of walk you through. We have a lot of different notices because, as you can imagine, there are a lot of different circumstances that we need to provide notices or letters to people about. So we'll kind of walk you through, we've grouped types together, so we'll walk you through all that. At the end of the presentation, we'll also show you where you can find all of the draft notices. If you'd like to take a more in-depth look at those notices, we've got those out on our My Choice Matters website, and you can actually access those now as well. If you want to look at them, we've kind of got them numbered, so you may be able to follow along if you'd like to as we kind of review things. Or you'll be able to kind of look at our presentation with our notice numbers if you want to review later, and then you'll be able to kind of connect what notice is which in the group of notices that we have. But again, we'll have all of our draft notices on the My Choice Matters website. They're all in separate folders, so you can take a look at one topic at a time and look at the various notices related to each topic. And we'll show you that at the end of the presentation as well. As we walk through the presentation, we'd like to answer questions if we can about questions that you may have about the notices, and give you ways to provide feedback or comments to the department. After this meeting, we'll have email and phone numbers and that sort of thing that you can provide feedback to us about the notices. And so we want to get that feedback on how we can make the notices as understandable as possible for participants, guardians, and family members. Okay, so we're going to kind of start with the basics. So the department and the independent assessment contractor, which you guys I think may know as Liberty Healthcare, sends letters. Letters are also called notices, to tell people important information about to share important information with people who apply for or are receiving adult DD services. So the letters or the notices can be sent on a number of topics. We can tell you about whether or not you're determined to be eligible for the adult DD program. We use notices to tell people what their annual budget would be for services in the program. We use notices to talk about service plans and whether or not your plan is approved or if something needs to change in your service plan. We also use notices, even once you have your service plan, there may be things that you need to change on your plan or to your budget that happens later in the year. And so we use notices to talk about decisions the department makes regarding budget change request. And we also use notices a lot when we're kind of reviewing applications or doing that annual redetermination, where if we need additional information, we'll use notices to contact you and let you know that we need additional information in order to process your request. And a lot of these notices do come with the right to appeal the decision that's made by the department. So if we make a decision and say, you know, your budget is X amount, is a certain amount of dollars, we would also have information in that notice that tells you how to appeal if you don't agree with that budget. And so that's kind of the general overview of kind of the purposes that we send notices for. And there are about 5 kind of main groups of types of notices that we have. We have that are associated kind of with different stages of the application and assessment and getting services, kind of that whole process. Different stages have different notices. And so the application stage A lot of times at the application stage, individuals will see notices as request for more information, or could be for more information from the individual who's applying, or more information from their doctor about their disability or the related conditions to their disability. Once we move through that application process and we get to the assessment process, there can be notices that are sent out to help schedule assessments. If during the assessment process, someone is determined to not be eligible for the adult DD program, there would be a notice for a denial, which means telling someone that they are not going to be able to receive services from the adult DD program. Also during the assessment period, I'm going to take a step back just real quick. When we talk about the new resource allocation model, for those of you who have kind of been in other presentations with us, but I'm going to back up a little bit for those who may not have. For our new resource allocation model, we conduct assessments when an individual applies or on an annual basis. To help determine an individual's level of support, or the level of support that an individual needs kind of in their day-to-day life. And we are going to be using that CIS-A assessment to conduct those assessments. And levels of support generally go from the lowest level of need at a level 1, gradually increasing from 2 to level 3 to that higher need. And we also have levels M or B. And in those levels, people can be assigned to those levels if they have extraordinary medical or behavioral support needs. And we are working on providing more information about how one qualifies for that medical or behavioral support budget. But for the purposes of this presentation, you need to know that individuals could request to be assigned to level M or B during their assessment. And then the assessor would need to verify that the individual had that extraordinary support need. And we call that the verification process. And so during the assessment, there may be, an individual may receive a letter or a notice that the assessors need more information to complete that verification review. Also during the assessment, if someone is transitioning perhaps from, say, the children's program into that adult DD program, sometimes the cognitive evaluations or the medical documentation may be a little bit different from the children's program to the adult program. And so you'll also see potentially notices that Liberty would provide to tell people what they may need for their next assessment. So if we know, like in your next assessment, we're going to need some additional documentation, we try to give you the heads up on that and give you that information in a notice. So if this year you get your assessment and we say next year we're going to need this type of assessment or this type of medical documentation. So it really is just a way to help make sure that you guys have time to prepare and pull together the documentation we would need for the next assessment. The next step in the process that has notices would be when you get your budget. So if a person is approved to receive services from the adult DD program, they would get a notice that explains their eligibility, so that you were approved to receive services. And it would also tell you what your annual budget would be for the upcoming plan year. As we kind of move down the process, we also have notices related to developing a plan. And so I think, as you guys know, when you write a plan, when you work with your person-centered planning team to write a plan, that plan gets submitted to the department, and the department reviews it and is able to either approve and prior authorize the services on your plan, or they may send you a letter saying, we can't approve, we have to deny this service for some reason. And we would provide the reasons why we can't approve your plan. And so that would also be in those notices. Other notices related to plans are if it's coming up on the expiration of your current plan and we still haven't got a new plan in for you yet, we'd provide a notice to your support broker or your TSC that the plan is late and that they need to go ahead and get that submitted. And so those are the types of notices related to plan development. Once you get an approved plan and you start getting services, we recognize that there may be situations that occur or things that happen where you may have a change in your condition or and you need to request a change to your budget because of the change in your condition. Or there are other reasons why, and we'll talk through in more detail kind of some of these that are listed here, but there are other reasons where there might need to be a change kind of mid-year to your budget. And so we have notices that respond to your request to change your budget, whether or not you make a request for a change of condition or a request to a service mix change, or those sorts of things. We have a set of notices that kind of goes with that as well. So again, as we kind of move through this presentation, just kind of keep in mind we'll talk about in more detail each one of these groupings. So we'll talk about notices at application, assessment, getting your budget, developing your plan, and making changes.
So to give Karen a little bit of a break from having to talk the whole time, I'm going to do some of these slides to help her out. So the first thing we're going to start with is around notices regarding the application. So notices about the application are often sent when somebody has applied for services, but there's just not enough information yet to know if they're eligible. And when you go to look at the draft notices, notices that are on that topic are titled General Notice 1 and General Notice 3. If an applicant is not able to provide documentation that they have a developmental disability, then their application for services will be denied and they will not get services. The notice that relates to that situation is known as General 6. An applicant has to say when they apply for services what it is they want. Here is just a screenshot of the new, slightly modified application for services. And if you see, it says, what services are you seeking? And you can check whether you want DD waiver services or traditional services, whether you want self-direction or you only want state plan, which in the new model will include service coordination, community habilitation, developmental therapy, and non-medical transportation. It'll be important to know which of these you checked at the application phase because that will help determine which eligibility notice you would get in the future. Next are the assessment notices. So in order to qualify for adult DD services, each participant has to have a reassessment every year. If there is not enough information to redetermine if somebody is eligible, then you will get a notice of general number 7 saying, hey, we don't have enough information yet to know if you are going to remain eligible. If the independent assessment contractor, Liberty, isn't able to reach the participant or their guardian in order to schedule an assessment, or if the participant and guardian have missed those scheduled assessments, they will get notices that relate to that situation, reminding folks that it really is necessary to get an assessment in order to remain eligible for services. Notices on that topic are numbered General 4, 5, 8, and 9. And if the assessment is not completed, a participant will have to be denied eligibility and could lose their adult DD services. Those notices are referred to as General 6 and 10. There's also a notice that can be sent if a participant is going to need that updated information around their medical or cognitive evaluation before their next assessment. Again, that's generally related to folks who are moving from the children's program to the adult program and will need to have some documentation of a new assessment. And the number of that notice is General 2. So as Karen already kind of outlined, when someone is getting their assessments, which in the new program will be the Vineland 3 and the SIS-A, they can request verification at that time. The assessor will tell a participant, if they've requested verification, that they need to submit the verification questionnaire, which is a somewhat new document, and there's a screenshot here on the slide, and any other supporting documentation within 14 days of that assessment. The participant's also going to receive a notice that reminds them to submit that documentation, and the notice itself also includes the questionnaire to make sure that a participant has access to that. And that notice is referred to as verification 1. If the verification review team needs more information after what the participant submits with the verification questionnaire and that documentation, in order to figure out if that participant meets the criteria for level M, and again, level M is the level for participants who have extraordinary medical support needs, or level B, which is the level for participants who have extraordinary behavioral support needs, they will get a notice that requests additional documentation. That letter is verification 5, and we actually have included a snippet from that draft letter on this slide. Do you want to walk folks through that one, Karen?
Sure. So in this notice, we note that the verification team has reviewed the relevant documents that were either submitted by the participant or that the department had on file, but that we identified additional information that we needed. And so in this second paragraph, you'll be able, and I do that every time, in this second paragraph, you'll be able to see the assessor will fill in the reasons that we need additional documentation, and will outline the documentation that we're requesting. And the assessor will also let the individual know the date that they need to return that documentation to the verification review team so that the review team can finish their evaluation. And then for verification as well, for those of you that may recall, individuals, when you are assessed, we have additional questions as part of the assessment that would flag individuals as possibly meeting the criteria for levels M or level B based on their responses to the SIS-A and those supplemental questions. Participants who are flagged will be asked if they'd like to go through that verification review process to see if they qualify for the budgets that are associated with level M. Again, extraordinary medical support needs, or level B for extraordinary behavioral support needs. If a participant says that they don't want to go through that verification review, if they decline to do that review process, submit documents and undergo that review, the individual will get a notice from Liberty that says, you know, that they understand the impact of not going through verification review, which basically just says they know what verification review is, and they understand that they won't be able to receive those levels M or B if they don't go through verification. That notice in the list of notices is verification 6. And then participants who go through a verification review will get the results of that review in their standard eligibility and budget notice.
So before we move on to the next slide, why don't we stop for questions, because that takes us through the notices regarding both application and the notices that are regarding the assessment process. So I can read those out, Karen, if that is helpful. So one question that came through is, if more information is required from a doctor's office or a professional, and it's not possible to get that information until after the window of investigation has closed, is there a process to add those supports back once the documentation is submitted or after the support without that verification was provided?
So I think for the application process, Liberty will, you know, send a letter that says what documentation they need, and it won't just be that letter. We actually do follow up. We make a few phone calls to see, you know, to remind people to provide that information. If we aren't able to get that documentation, there could be a denial for the program, but individuals would be able to, once they had that documentation, would be able to reapply, and we would go through the process with the updated documentation.
The next question is, how can budgets be given prior to knowing what plans are?
Alina, would you like to field that one?
Yeah, I can talk about that a little bit. So the budgets that are given are not intended to encompass everything that a participant may need to receive. The purpose of the budget is to outline a general amount of dollars that should be sufficient to meet a participant's needs based on their assessed level of support need, so the level that they've been assigned, and the type of residential habilitation support they've selected to receive, if any. That's what we call their service mix. So the budgets that someone receives is only supposed to cover enough dollars to get the residential support you need and the discretionary support you need. And discretionary supports tend to be the kinds of supports around the things that people do during the day or on the weekends to fill their days and have a meaningful life. In addition to the budget that's provided using the new budget model, participants can also get specific services that are needed for health and safety reasons, and can also get specific services for employment above those budget dollars. Participants also, if in drafting the plan, realize that to get the level of supports they need to be healthy and safe in their community, can also request a budget modification due to health or safety, which would also then increase the budget. So a budget is provided as a starting place, and then through the plan development process, a person and their support team will identify what's the right combination of supports to meet their needs, what services or supports may they need that are not intended to come out of the budget, and if needed, additional budget dollars can be allocated through the budget modification to ensure that someone's service plan can be developed and implemented in a way that's going to meet their needs. All right.
Great.
The next question, Karen, is on the application, how will they know what services they want or need if they have never been on services? Most don't know what these services are according to the title.
Sure. So when individuals get the application, the specialist who helps provide that application can direct individuals to the BDDS website that will have a little bit more information about what services are available and that sort of thing. But if a person doesn't know what to check, I think the assessor can help the individual a bit, maybe through the assessment process. And if it turns out that the individual wants to request more than they did on the original application, we can always go through and review and change that request and review that application again.
The next question says, participants are being told to use the application to transition from DD traditional to self-direction, but this application doesn't have a checkbox for that. Can that process or this form be improved? I can take this one if you'd like, Karen, and that is the revised application has a checkbox for someone when they're initially applying to either seek traditional DD waiver, self-direction DD waiver, or to seek state plan only. In the new model moving forward, if a participant wants to move from traditional to self-direction, that process can happen by doing a change in service mix request. That's also the process someone will use if they want to move from receiving services from a certified family home to receiving services from a supported living provider, for example. So that will be a new addition to the process, and that will be how folks can transition from traditional to self-direction or vice versa into the future.
Great, thank you, Alina. And I'm looking, there are a couple of questions about how individuals would submit documentation for their application. And I think that's something definitely service coordinators would be able to help out with that. And I think On the application, Lydia, are you online right now? I think on the application, it includes a list of care managers that can be contacted if an individual has more questions about how to submit the application. It has a list of care managers in each region that can be contacted. So if an individual has questions about that documentation, they can just reach out to one of our regional offices as well. I'm seeing several questions about the budget, and I think we're going to hold on those questions a little bit as we move through the rest of the notice presentation. And it may be that we need to have a separate meeting, kind of more discussing those budgets and what those are included in. But today we'd like to really focus on the notices and kind of the reasons why people get notices. So I think we're going to keep that focus. I do see one question that says, what if you disagree with the Liberty assessment? I will say in the notices, if you disagree with their assessment, the notices actually will include information on how you can appeal that decision. So how you can tell the department that you disagree with that decision. And it gives you all the steps and the information needed so that you can appeal that decision and we can take another look at it. Okay. I think with that, we are going to move to the next set of circumstances for notices, which is adult DD eligibility and budget notices. Once participants get a notice, our participants get one notice that tell them about both their program eligibility and their budget for their upcoming plan year. These notices are a little bit different depending on if an individual is a first-time applicant or an initial applicant to a program, or if someone is already receiving services who is going through their annual redetermination. Initial eligibility and budget notices will include information about how to find a targeted service coordinator or a support broker, because we know people coming into the program don't yet have those providers yet. And so we offer in those notices a way to find out who could provide those services. If the eligibility assessment finds that a person applying is not eligible for any adult DD program services, they'll get a denial notice and then they won't be assigned a budget. But as long as an individual is approved for services, they get that eligibility approval and their budget notice. Okay, so we talked a little bit here, or I talked a little bit on the slide before, that the notices look different for initial notices for people who are initial applicants to the program and for individuals who are doing their annual redetermination. So the initial notices are broken down into several different groups. There are notices for people who choose the traditional waiver services. And then when you choose traditional, if you choose to go through that verification process, which is, do you qualify for level M or level B, there'll be one notice, type of notice, if you choose to go through verification, which is IN for initial 04. If the individual chooses traditional and they don't go through verification, the notice will be IN 01. Also for the initial notices, if someone chooses the self-direction pathway instead of the traditional pathway, they would get a little bit different notice that talks about their budget for self-direction. But again, there would be a different notice for self-direction if the person requested verification or if they did not request verification, and those are IN 05 and 02. And in the initial notices, there will be notices for those individuals who applied for state plan only. Again, as Alina mentioned earlier in the presentation, that's going to be for people who just want those community habilitation, developmental therapy, service coordination, and non-medical transportation services. So if you apply only for the state plan services, we have one notice for individuals who apply with verification to that level M or B, and another notice for individuals who don't want to seek verification. And the difference in those really is just so that one set has the results of that verification review. So you know exactly what the department reviewed and what decision they made about verification. But if an individual didn't choose to go through verification, they don't need all of that extra information. And we have very similar notices for people who are going through their annual redetermination. Again, it looks a little different when you're getting a budget for the second time. We have some additional information that we need to provide to folks when they do their annual notices, but they're grouped very similarly in the traditional with verification or without, self-direction with verification or without, and state plan only with verification or without. And again, if you take a look, the way these are numbered and the way they'll be numbered in the folders is notices, eligibility and budget notices related to initial applicants start with that IN, and notices related to annual redeterminations on eligibility and budget start with AN for the annual.
So one of the things just to note about that whole universe that we just talked about is that there are major components of each of those notices that are going to be the same throughout. So one of the things we did with the new budget notices is to break them up into a variety of different sections. And so it'll be a little bit easier in the new notices to know exactly what's the topic we're talking about in a given moment. Would you go to the next slide, Karen? So the sections that are going to be included in almost all of the notice, or in all of the budget and eligibility notices, are a section on the eligibility decision, a section on the budget decision, a section on the budget modification information, a section on submitting a plan of service, and then a section on appeals. Only those notices where someone requested verification, there will also be a section called the verification review decision, because only folks who requested verification review will have that information that they'll need to be informed of. Now remember, I think we've already mentioned it, but it's good just to clarify that when we move into the new model, the assessment for determining eligibility is the Vineland 3, and the assessment for assigning budgets is the SIS-A.
And in those, I'll just add this real quick before we move to the next slide, Alina. In those notices, you'll get the results will be included for your Vineland 3 and your SIS-A. So you'll have all that information in your notice as well.
So to make this just a little bit more complicated, we're still in the midst of a pandemic. And so as a result of that, and because of COVID-19, we are still in a public health emergency, and we don't know when that will technically end. The federal government also provided states with extra money to provide extra supports and services because of that public health emergency. Those extra funds were provided through something known as the American Rescue Plan, or ARP. The Centers for Medicare and Medicaid, which is CMS, put in place special rules because of the public health emergency. They also said that states can only keep the money that they got from ARP if they do certain things. Because of all of these factors, those rules were going to impact the way we start to use the new budget model. So the rules around ARP say essentially three things. First, that a state cannot make it any harder for someone to be found eligible for services than they were on April 1st, 2021. That's the date that the ARP legislation came out. The second is that people must be able to keep getting the amount and the type of services that they were getting, again, on April 1st of last year. And third, provider rates cannot go lower than they were on April 1st of last year. So the department is still working with CMS to figure out exactly how this will impact the implementation of the new budget model. But for now, what the department thinks is that it means that everyone who is currently eligible for DD program will stay eligible, and participants will have access to their current budget until all of the ARP requirements have been met. So this is the first section of the budget eligibility notice. And this is an example from someone who is applying to the program for the very first time. It starts by telling the participant what was used to determine if they were eligible for the program. So as you can see, it says there is supporting documentation. So a physician's history and physical, medical support and developmental history, cognitive testing, and then any other documentation you submitted around medical and behavioral needs. The department also looks at your scores from the Vineland to determine if you were eligible. It then tells you what you were found eligible for. The first bullet says you meet the developmental disability criteria, and it tells you exactly where that criteria is listed. This bullet is referring to whether or not you are eligible for adult DD state plan services. The second bullet tells you whether or not you meet the intermediate care facility for persons with disabilities level of care criteria. That's a fancy way of saying that you meet the criteria for the adult DD waiver. Under those two bullets, there's going to be a nice sentence in bold on each of the notices that gives you the high level information. You have qualified to receive adult DD state plan services and adult DD waiver services for the upcoming plan year. As Karen already mentioned, attached to the end of all of the eligibility and budget notices will be the results from your Vineland. Now, also on every single eligibility section of the notice, there's a sentence that essentially says this: you have the right to appeal this decision. And there are instructions on how to appeal this decision that are provided in the appeals information section below. Now, you may be wondering why someone would want to appeal this decision. In this circumstance, they qualified for all the services that are offered from the department, both the state plan services and the waiver services. It's still important that participants know that eligibility decisions are always appealable, whether or not they agree with the decision. So it's very rare that a participant would want to appeal this decision, but we still want to make sure folks know that it is an appealable decision, and that is why it's included in this section.
Do you want me to take this next section, Lena?
Sure.
So the next slide that you see here would be an example of a notice for someone who meets the developmental disability criteria. So as Alina mentioned before, they meet the criteria to receive those state plan DD services, but they do not meet the criteria for the intermediate care facility for persons with intellectual disabilities, that level of care. When the state or when the department identifies that you do not meet the criteria for that ICFID level of care, you'll see there's 3 different check boxes down here. We will tell you the reason why you don't meet that criteria. So you know exactly why the department made the decision that it made and said that you do not meet it. Like Alina mentioned, there'll be a bold statement after the you meet or you do not meet, and it'll tell you exactly what services you can continue receiving. So in this case, we see this is an eligibility decision related to what we think will happen because of those ARP rules that Alina mentioned earlier. And it says, due to that public health emergency, while the person did not meet the criteria for the ICFID level of care, that they will still be able to retain their eligibility and be able to continue receiving services for the adult DD state plan and the adult DD waiver services in the upcoming plan year, and we state that plan year. So this notice would be for someone who has already been in the program and already receiving state plan and adult DD waiver services, and for whatever reason, during their redetermination, it was determined that they no longer meet that level of care criteria. So while we have all those rules in place for the ARP, an individual we would let you know that you did not meet the criteria, but we would also tell you down here below that you would still be able to receive those services. And we'd identify the start date and the end date for when you would be able to receive those services. Alina, I don't know if you want to talk a little bit here about the fact that individuals will be able to retain their eligibility for a year, but then the next year we'd have to take a look again and see if all those ARP rules still required us to retain someone's eligibility, or if those ARP rules no longer did. And so it kind of would go from a year-to-year basis. But once an individual gets a notice that says they get services for the upcoming plan year and identifies that plan start date, they would be able to continue to get services for that year. Do you have anything to add to that, Alina?
The one thing I'll just add to that is that, yes, so the way that the ARP rules exist, and I'll just repeat the ARP rules again. I saw a question asking for them to be repeated, so so the rules are that the state can't make it any harder for someone to be found eligible for services than it was on April 1st of 2021. The second is that people must be able to keep getting the amount and type of services they were getting on April 1st, 2021. And the third is that the rate that are paid to providers cannot go lower than it was on April 1st, 2021. So while the ARP requirements are in place, that means that people who were eligible for services on April 1st of 2021 need to still be able to get those services. So what that means is that even if you are no longer found eligible at your next assessment for the ICF level of care, you will still be able to access those services. And then, just like always, you will go ahead and get another assessment at the annual date. And again, you will go through the assessment process and they'll determine whether or not you are eligible for state plan services and whether or not you are eligible for DD services. And then you'll get a new notice. If that person has changed and now they say, yep, you actually do meet on both. Okay, we're good to go. If nope, the person still doesn't meet the ICF criteria, then the question becomes, well, are the ARP requirements still in place? So the ARP requirements are expected to be in place until March of 2024. However, it could be a little bit earlier or later than that. But what that means is that we expect that from now through probably March of 2024, whatever services a current participant is eligible for right now, if it's state plan, they'll remain eligible for state plan. If it's both state plan and waiver, they will remain eligible for both of those, no matter the outcome of their eligibility determination during that period. But everyone will still get their assessments every year because that is a requirement of services.
And I will just add, Alina, on that those ARP requirements and what the state is required to do really is decided kind of at that federal level. So it really is, this is what we believe will happen right now and what those notices will look like. But we are working with CMS to still kind of work through all of those all of the issues related to this. And so, but we did want to give you an idea of what it could look like. But just know that that may change a little bit depending on the input that we get from CMS.
So the next slide wants to give folks an overview of what the universe of denial notices look like while ARP is in place. So again, it's divided between initial denials and annual denials. So if you are somebody who is applying for services for the very first time and you are found to not be eligible for the program at all, then you will get denial notice 1 or DN1. If you are a participant who is applying for services for the very first time and you are not found eligible for the waiver, but you are eligible for state plan, then which notice you get will vary based on whether or not you asked for verification. If you didn't ask for verification, then you'll get denial notice 2. And if you did, you'll get denial notice 3. For folks who are already receiving program services, they will get a different set of denial notices. If in the past you were found eligible for the program and now the determination is you're not eligible for the program at all, you will either get, depending on what you were receiving on April 1st of 2021, you will get either a notice that says you were denied, but you get to keep all your traditional waiver services. You were denied, but you get to keep your self-directed waiver services, or you were denied, but you get to keep your state plan services. And again, which of those you receive would be based on what services you are already receiving. A participant also could be reassessed and found that they're no longer eligible for the waiver, but are still found eligible for state plan. If that's the situation, then somebody would get a denial only if they were already receiving traditional waiver services or if they were already receiving SD waiver services, because in the past they were approved for waiver. We now are seeing that they're being denied, but they get to keep those services while ARP is in place. With that, I think we should pause and do questions before our break, and then we'll dig into more detail on the budget decisions. And I see that a lot of questions have come in. So let me scroll up. All right. I see a question around appealing decisions. I'm going to hold that question until we get to that section of the notices. Oh, I see a question here that says, when we refer to the current budget participants have access to, are we referring to the budget assigned by Liberty or the lawsuit budget? What we are referring to is essentially the KW budget. So it's the budget that the participant had access to on between April 1st of 2021 and when the new model goes into effect. So we anticipate May 1st of 2022. So that would more or less equal for most people what they currently call their KW budget. But those budgets will now be in place because of ARP, not KW. The next question asks whether the results of the CIS-A and the Vineland 3 will each be 1 page in length. Just wondering how easy they will be to read and understand the scores. Do you want to take that one, Karen?
I don't know if they are just 1 page. I know they are summarized results, so it shouldn't be too long of a page of assessments. Michael or Livia, do you have any more information on what those results will look like?
Unfortunately, I do not.
Okay.
I don't either.
We can definitely look into that though, and as we get closer to implementation, I feel sure that we can give you some more detail about what we think those outputs are going to look like in attachments to the notices.
Yeah, we'll be able to provide examples of what those will look like. So thank you for your question so that we can remember to do that.
The next question is, will the letters or other types of information be sent in other languages?
Michael, do you want to respond to that?
So at this time, our notices are sent out in English, but there are also information provided with each notice on how to access translation services. So we'll continue to address that moving forward, but we do provide access to translation services as needed with the notices.
Great. Thank you, Michael.
The next question is, if the provider rates have raised, will the budgets which have already been set be adjusted to cover the provider rate increases? So I can speak to with regard to the new model, and that is right now, the budgets that have been identified for the new model are not finalized. So the way that the new model works is we use model mixes, which is based on the rate of that are being paid to providers, as well as the number of hours of support that are in each of the model mix. One of the reasons why we do it that way is so that when provider rates change, we can change that figure and adjust the budgets accordingly. So once the department knows what the legislature's decisions are with regard to the proposed rate changes, we can then adjust the figures or the inputs that go into the model mixes, which may adjust the budgets that are proposed for participants based on their level and service mix.
I also see a question, Elena, that says, will providers and participants get guidance from the department on how to document level of support to ensure they are getting all the services they need? So your level of support could be decided in a couple of ways. It could be decided through the results of the CISA assessment. And those scores in the CISA assessment could assign someone to level 1, 2, or 3 for their level of support. The level of support could also be assigned if an individual has extraordinary medical or behavioral support needs, and the department will be providing additional information on the types of documents that would help support and show and demonstrate that someone has that extraordinary medical or behavioral support need. So we will be providing additional documentation and guidance on that.
I'll just confirm again that this meeting is being recorded, and the recording of this meeting will be placed on the My Choice Matters website. I see someone has to leave midway through. Thank you for attending for what you could. This recording will be made available. I also see a couple of folks wanting to clarify exactly what state plan is. Could you walk through that a little bit, Karen?
Sure, absolutely. So the adult DD program has kind of two groupings of services, and what services a participant can access or is eligible for depends kind of on their level of need. So if an individual is determined to have that developmental disability that we talked about in one of the notices, the developmental disability eligibility criteria, if they have a developmental disability, then the individual would qualify to receive state plan services. And when we say state plan HCBS services, we're talking about home and community-based services that are part of kind of the document with CMS, where we have a lot of our other medical services that CMS has approved. But essentially, those state plan services are going to be, in the new model, will be community habilitation, which is a service that just helps people access their community and do things that they want to do in the community. An individual would also be able to access developmental therapy and non-medical transportation if they were approved for state plan home and community-based services only. The next level that an individual could apply for would be to apply for those waiver services. And to be eligible for a waiver services, you have to meet that intermediate care facility level of care requirements, which is a little bit higher requirement than if you meet the developmental disability requirement. So it's a little bit more need, but for those individuals who have more need, if they qualify for that service or for the waiver, then they would have access to our waiver services like supported living or certified family homes or home delivered meals or things like adult day health and those types of services. And so the difference between the state plan and the waiver really is about the level of need that a person has. And then once we decide what level of need an individual has, then they have certain services that are available to them.
I have another question here, Karen, where someone asks both whether their annual reevaluation is really needed, and then another question that asks if a new CIS-A will be required each year.
Those are great questions. So An annual evaluation or redetermination is necessary every year. The federal government actually requires the state to do those redeterminations and evaluations every year. And so that is a requirement. So we can't make those longer than 1 year. We can't push those out any more than 1 year. But the SIS-A itself, what the department can do is that once an individual has completed their full SIS-A assessment and their full Vineland assessment, remember the Vineland is what helps us figure out eligibility, and the SIS-A is the assessment that helps us determine what a person's budget should be. Once they've completed that full assessment, the next 2 years, the assessor will just ask the individual questions about their medical conditions or their behavioral needs and that sort of thing to determine whether or not the assessment still reflects the kind of current status of the individual, or if maybe something has changed for the individual and we do need to do a new assessment. But an individual will only have to do, if nothing has changed, if their condition has not changed and nothing's really changed in their circumstances, an individual would only need to do a full Vineland and a full SIS-A assessment every 3 years.
Just to answer another question that came up, yes, Liberty is currently the independent assessment contractor that does both the Vineland and the SIS-A. Also, just a reminder for folks that when we're talking about the new budget notices, we are talking about notices that will come in the future. If you are to receive a budget notice for a plan that starts, in the next month or two, you will not see this information yet. We are currently anticipating beginning the new budget model where you will see all of these changes implemented starting on May 1st of this year. So that will be for assessments that are conducted on May 2nd or after, and then the notices that follow from there. So while we are talking about this information now, getting feedback from you to adjust these notices, these are not in place yet.
So I also see a question that asks if home and community-based services, do waivered services separate home and community? Do self-directed services cover supports in the home or community? Are they supposed to be separated? If someone opts to use self-direct, isn't it less cumbersome to the department if all of these services are written into one support plan instead of being separated into multiple programs? So when we say home and community-based services, we're talking about a type of service that CMS says we can provide to individuals who have developmental disabilities. They could be services that are provided in an individual's home, like supported living, or it could be services that are provided in the community, like going to the DDA or going and adult day health or something like that. It's important to note that even though we have kind of different agreements with CMS about what services we can provide and who we can provide them to, once you get a notice, if an individual gets a notice that they've been approved for both, they would write one plan to cover all of their service needs. And if an individual is approved for those waiver services and they choose traditional, again, they would write one plan for all of their service needs under the waiver. Or if they chose self-direct, they would still just write one plan for all of their self-directed services. And so just because we talk about services, whether or not they're in the home or in the community, it would not require separate service plans. The individual would still be writing just one service plan.
So I think with that, we should go ahead and take our break. We've still got a lot of ground to cover, and I know some of the questions that I see will be addressed in some of our next slides. Did you say a 10-minute break, Karen? Is that our plan?
Maybe we go
Maybe.
till 3:15. That'll be about an 8 minute, 7 or 8 minute break. So we'll come
Awesome.
back at 3:15. Okay, it's about 3:16, so I think we'll go ahead and get started. Again, Alina, would you like to start us off?
Happy to do so. So just a reminder for folks that under the new budget model, participants' budgets are based on two main factors. That is their chosen service mix, or the way that they choose to get their supports, and their assigned support level. So folks' chosen service mix, there are 7 different mixes that exist. For folks who are only obtaining state plan services, as Karen already described, there is one service mix, the state plan HCBS only. For folks who are choosing to receive traditional services, there are 3 different service mixes. If they're choosing to receive their services in a certified family home, that's one mix. If they're choosing to receive services in a supported living from a supported living provider, that's another mix. And if they're choosing not to receive any residential habilitation supports, then they would receive the community supports only mix. There are also 3 nearly analogous service mixes in self-direction. Participants who live with the person who provides their in-home supports, often this is maybe through a certified family home provider, they would receive the self-directed live-in support service mix. For participants who self-direct but don't get any supports in their home, they would receive the community-only support service mix. And for participants who receive supports from individuals who come into their home to help them but do not live with them, so more analogous to supported living, they would receive the self-directed outside support service mix. Again, the service mix is completely based on participant choice, except in those circumstances where someone is only eligible for state plan, then they only have one service mix option. When we're talking about assigned support levels, there are 5 support levels. Support levels based on general support need move from low to high, 1, 2, and 3. Participants can also be verified as having an extraordinary medical support need or an extraordinary behavioral support need through the verification review process. Individuals who are identified as meeting the criteria for level M will get that support level, and folks who are found to have an extraordinary behavior support need meeting a very specific criteria will be assigned to level B. So the budget notice is going to tell each participant what service mix they were selected and what level they were assigned. A reminder, in order to be assigned to levels M or B, you have to go through verification. Notices are also going to include an attachment, as we've already described, explaining how that level was assigned and the participant's CIS-A results. Remember that levels 1, 2, and 3 are going to be based just on CIS-A results, while levels M or B will be identified based on that verification process. So essentially, this paragraph exists in all of the budget notices. At your assessment, you inform the assessor you would like to either self-direct or use traditional waiver services. You told your assessor what kind of support you wanted to receive in your home. As a result, you have been assigned to and then we will insert which service mix you selected. It then will state you have been assigned to, and whichever support level, 1, 2, 3, M, or B, based on your responses to the Supports Intensity Scale Adult CIS-A functional assessment and/or the outcome of your request for verification review. That sentence only exists in the notices for participants who requested verification review, and there's a whole section of those notices that explains to them the results of verification. So I saw a question come through before the break asking, are we still going to find out about the budgets with the new model, even though we're still going to have access to our budgets today? And the answer is yes. So the budget notices starting in May, or we anticipate starting in May, will include a variety of different language around budgets because due to the ARP requirements, the department cannot move fully into the budgets that are determined using the new model. Budgets that are based on your service mix and your support level are going to be known as your advisory budget. Advisory budgets are then in the notice going to be broken down into some additional categories for folks who use traditional, and that will be a residential, discretionary, and planning supports category. For participants who self-direct, there's only one budget for your advisory budget, and they can use those dollars flexibly to receive either residential supports or discretionary supports. Participants are also going to see on their notice their ARP budget. The ARP budget is the highest budget that they were assigned between April 1st of 2021 and May 1st of 2022. For almost all participants, what that's going to look like is the KW budget you see on your notices today. Then, participants will find out what their assigned budget is. That simply means, what's the budget that you can use? The assigned budget is just the greater of those two. So, if you are a participant who, based on the new model, is going to have a budget of $5, that's not really a budget amount, but I only work in small numbers, and under your KW budget or your ARP budget, your budget was only $2, then your assigned budget is going to be the $5. If you are a participant who currently has a budget of $5 using your KW budget, but the new advisory budget is only $4, then your assigned budget is also going to be $5 because it's simply the greater of either your advisory budget or your ARP budget. Remember that once the ARP obligations go away, which we anticipate as being in March of 2024, and then participants get a new plan with a new plan year, their next plan year will only have one budget amount, and that will be the budget based on the new model. Anything you'd want to add to that, Karen? Oh, you're on mute.
I did not unmute myself from the break. No, I think that's a great explanation for us, Alina.
All right.
Okay.
So, I just said this from memory instead of going to the slide. No, go ahead.
Okay.
So as I just said, again, the ARP budget's not permanent. We think they're going to go away in around March. The other thing to remember is that only services that meet program requirements can be prior authorized, even if they are within a participant's budget. So there are certain things that someone may want to get supports with or spend dollars on that are not allowed from the program requirements. Even if there are budget dollars available, they still cannot use the budget to purchase those items. But any supports that are needed and prior authorized can be purchased within a participant's budget, and participants can also exceed that budget if they need something for a health or safety reason through a budget modification. So this is just an excerpt from the budget notices that exists on every single one of the versions of the budget notices. And it talks about where you can find your CIS-A results, and that is attachment 2. It also reminds you that if you disagree with your assigned support level, that is something you may appeal. Again, it'll point you to the appeals information section of the notice to get more information about that. This section also reminds people that you can get more information about how your advisory budget was decided in attachment 3 to the notice. And if you disagree with your advisory budget, you can also appeal that amount or or you can request a budget modification. You can request a budget modification without having to make an appeal, simply when you submit your plan of service. There's a whole section in the notice just about budget modifications.
Great. So the attachment 3 that we just talked about that tells people the service mix that they were assigned will look something like what you see on the screen, where we'll say if you were assigned, in this case, an individual chose that community only supported living or community only support service mix. And in each service mix, we'll identify the budget that's available for residential services. We'll identify the budget that's available for discretionary services. We'll identify the budget that's available for plan development and service coordination. And then we'll identify the total amount of the budget that the individual is being assigned under the new resource allocation model. Again, remember that under those ARP rules, an individual may be assigned $25,000, or if they were in level 1 and only wanted community supports, that their budget would be $25,896. But if their KW budget was higher than that, their assigned budget would look more like that KW budget. And just for reference, right now, these budget amounts are all just draft amounts. We are still waiting for the legislature to review Medicaid's budget request and tell us what dollars have been approved and what dollars have not been approved. And so once we hear back from the legislature, we have one of these charts for all 7 of the service mixes, and we will go through and we will adjust the rates based on what the legislature approved for us. And we'll multiply the rates by the number of hours we think each person will use at each level, and we'll recalculate these budget amounts. And once we have those final amounts, we'll make these charts available on the My Choice Matters websites once we know those final amounts. And then once we have those final amounts, when we start issuing notices, you will get a version of this chart in your notice so that you know exactly how you can say, I chose no, community only supports, and I am a level 3. And so according to that, my budget should be 36,646. And so you'll be able to see that information as it applies to the service mix that you chose.
Before we move on to the next slide, I wonder if we should take a couple of questions because we're going to move into talking about verification a little bit more next. So one of the questions that came through, and I'm just going to read the whole thing, is for those on a self-direct plan who currently use a job coach, I understand in the future we will request those funds separately, but since the ARP requirements state we get the same services as in 2021, will we go through the process of requesting them separately with the initial budgets that come out in 22 and 2023? So we learn how to do that, or will there be further and more specific direction coming? So one of the things that will be happening moving forward is that even though the ARP budgets will exist, we will be moving to the new process with regard to how budgets are requested. So there will be some slight adjustments to the planning forms. There will be adjustments to the way that support brokers and TSCs enter information into the costing sheets for how they identify how you're going to spend your budget dollars. So all of this is going to give people an opportunity to get used to the way that the new model works and the breakdown of the new model while still having access to that larger dollar amount. So for participants who self-direct, yes, you will have access to your budget dollars that you had in 2021, but there is a separate section where you identify that you'd like to use some supports, some JSS supports for job supports, and then you would plug those in to a separate spot, and that would not come out of your budget dollars. So this is really an opportunity to get used to the new system and the new way of doing things, but there will still be some other budget dollars available. The next question, Karen, is do you have to have a CFH for self-directed live-in supports?
So the department is working through, and we have, in one of our previous presentations, we provided a kind of a decision tree for how individuals in self-direct will determine whether or not which service mix they should be assigned to. And so we kind of have a series of questions. So to have the live-in supports, it does not necessarily mean that an individual will be living in a certified family home. The question will be do you receive those self-direct supports in your home And does the person who provides those supports live with you? And if the answer is yes, then the individual would have that live-in supports budget. And again, that's the budget that's assigned. They would also have availability of their ARP budget. And if individuals also needed additional supports for health or safety reasons, they would be able to ask for those services as well.
I think that those are the questions that were most related to this section. Why don't we continue on to make sure we get through everything and before we take on some more questions?
Sure. So for the budget notices for the verification review decision, again, as we've kind of talked about throughout this presentation, participants will be assigned to level M if they require extraordinary support due to a chronic or acute medical condition. Participants will be assigned to level B if they require extraordinary support due to one of the following: a criminal conviction related to serious injury or harm of another person, predatory sexual activity, or serious aggressive behaviors. And we'll have more detailed explanations of these criteria are in our rules, so this is just kind of a quick summary here. The budget notice, when an individual requests verification review, the budget notice will tell the participant if they meet any of the extraordinary support criteria. So did they meet level M and did they meet level B? It'll tell an individual what documents were reviewed by the department to make the decision and why the verification review team made the decision that they made. Participants will have a right to appeal that verification review decision. And as with other portions of the notice, that appeal information will be included in the notice when an individual has a right to appeal one of the decisions. So here, we also talk about the budget notices have information on how an individual can modify their budget. So once you have an assigned budget amount, it can be increased without an appeal if the individual submits a plan of service that includes designated health, safety, and employment services, and the individual shows that they meet the service-specific criteria to use that service. And I'm sure one of the questions that will come up is, how do we know what those services are and what the criteria are related to those to get those services? We have a list of the services in rule, and the criteria to receive those services are in those service descriptions. But to make it easier for individuals when they get these notices, there will be an attachment 4 to the notice that'll provide details and provide a list of all the health, safety, and employment services that are available to individuals. Those lists will look a little bit different if an individual chooses traditional services versus if they choose those self-directed services. But we'll have a list of the services and the criteria that the individual needs to meet to receive that service. And as long as they meet the criteria, their budget can be increased to cover those services. Additionally, if anybody needs any more residential or discretionary services that exceed their budget, they'll be able to demonstrate a health or safety need, and then we'd be able to increase their budget for those health or safety needs. While you don't have to use our form, an individual could submit the health risk form or the safety risk form. Oh, and look at me. I got a little ahead of myself too, Alina, and started calling out all the names of the services. So the following are the designated health and safety services. I mentioned that they look a little bit different for traditional versus self-direct. So this list on the left is the traditional list for behavioral consultation, community transition, crisis intervention, home delivered meals, environmental accessibility. So that's the home modifications. Personal emergency response system, skilled nursing, and specialized medical equipment. On the self-directed side, if someone needs adaptive equipment supports or skilled nursing supports, they can ask for those costs to be added separately to their budget. Again, participants can also receive community-supported employment if they're traditional, or job supports if they are going the self-directed route, and non-medical transportation or transportation supports to obtain or maintain competitive employment in addition to their assigned budget. So all the services kind of listed on this page are those services that individuals can request. If they meet the criteria, we can have additional dollars added to their budget to pay for these services. I mentioned previously that individuals could also get more of their residential services or more of their discretionary services if they had a health or safety need. We would just ask that you fill out the health risk form or the safety risk form to identify the need for the service and submit that to us to take a look at. These forms will also be included in your notice so that if you decide you need to make a request for a health or safety risk, those forms are already in the notice for you to be able to use and submit back to the department. So there are also budget notices, or also in the budget notices tells an individual how to submit a plan of service. So once we tell you what your budget is and ways you could modify it, we tell you how you can go ahead and submit that plan. We also give you the date by which we would expect an individual to submit their plan of service. And you have to submit that plan of service and get it prior authorized before you can begin receiving services. For initial notices, it's not actually in this example that we have here on the screen, but for initial notices, this section will also include information on how to find a targeted service coordinator or how to find a support broker. So we have lists of these types of providers on the department's website, and we'll be able to provide that information on where to go to look to identify and find one of these targeted service coordinators or support brokers. One of the final pieces and final sections that you'll see in your notice is the appeals information. This section, again, each section as we go through, again, like the eligibility notices and the budget decisions, each one of those sections says you have a right to appeal the department's decision. And you can see the appeals information for more information about how to submit that appeal. And so this is the information or the section that tells you more about how to submit an appeal. In this information, we let you know that if you want to appeal and request a hearing, that you can fill out the appeal request form, and we're including that, a copy of one of those in the notice for people that they can fill out, that you need to fill out that form and submit it to the department within 28 days of the date of the notice. And we'll tell you we'll calculate what that 28 days is, and we'll let you know the due date that you would need to submit your appeal request form.
So there's a question on an appeal that I thought I'd bring up right now, Karen, and that is, someone said, I've always been concerned with appealing the decision because of the clause DHW includes about you being liable for court fees if they do not change the appeal. How does that work?
So I don't know. So in the attachment 5, we have more information about that, but essentially, if you are already receiving services and you appeal, and it turns out that you weren't eligible to receive those services, then you could potentially be required to pay back the cost of the services that you received while we were working through that appeal. But I don't believe you would ever be responsible for the court cost for that appeal process.
Thanks, Karen.
Okay. Yep, and I am getting confirmation that there no court cost would be included in. So again, you can get the services using your assigned budget. So if you get an assigned budget that you want to appeal, you can use your assigned budget. And as long as you don't go over that assigned budget, you can continue to use your assigned budget while you're waiting for a decision in your appeal. And you can submit a service plan and start receiving services within that assigned budget. And then if your appeal, if we end up increasing your budget based on your appeal, then you would be able to submit a plan addendum to increase the services for the amount of the appeal and the amount that the budget was increased as a result of your appeal. This section also tells you that you can handle the appeal on your own, or you could have an attorney or another person of your choice to represent or help you with your appeal. And in that attachment 5, we provide more information about how people can get training to help with an appeal, how you could get training for yourself or someone that's going to help you. And we provide all that additional information in that attachment 5. And then at the end of every notice, there will also be contact information either for the department and for Liberty, or for directly to the Liberty assessor that completed your assessment. So this provides a little more details around what that attachment 5 about the appeals request process, what that would look like. It provides a lot of information about making an appeal. It provides contact information for the department. It provides, as you can see in this little excerpt, how long you have to request an appeal, how long the department has to start processing those appeals. And this information will be provided with every notice that comes with a right to appeal a decision by the department.
I think in the interest of time, we'll go through the end of the presentation, then circle back to all the questions we can get to. I also just want to note that the department has every intention of giving quite a few more presentations, listening sessions, opportunities for questions about the new model to be answered. So if we're not able to get to your question today, or there's a question specifically around how the new model works, there will be other opportunities to get more information as we get closer and closer to implementation. So there is a whole set of notices that are specifically around the program about your plans. So once a participant receives their eligibility and plan notice, they're going to go ahead and create their plan for the upcoming plan year. Now, these notices have not changed because of the new budget model, but we still wanted to make sure you understood what those notices included. So once a plan of service is submitted, the participant, their guardian, and their plan developer or support broker will receive a notice from their care manager. Generally, that notice is going to say whether or not the plan they submitted was approved, denied, or in some cases, approved for some services and denied for others. Participants also have the right to appeal a decision about their plan of service. In some circumstances, a participant may hear back from their care manager saying, you know what, this plan of service is incomplete, before they get that notice with the approval or denial. They may also get notices that say your plan was late, or you failed to submit a plan, or that your current plan of service has been extended to allow you time to submit your new plan. So as we talked about at the very beginning, once the plan year has begun, most participants are not going to get a lot of additional notices from the department or from Liberty. However, if something in your life has changed, you may then request a change, which will result in some additional notices. One kind of notice that people may get is around a change in condition. A change in condition is simply a functional, behavioral, or medical change for a participant that is so significant that it justifies needing to complete new assessments, so a new Vineland and a new CISA. Oftentimes, that will result in a new level assignment and thus a new budget. Participants may also get notices if they request a service mix change. That's a change in the participant's service mix, which will result in a new budget notice and a new service plan. So again, for participants who decide in the middle of the year, you know what, I was receiving traditional, but now I want to receive, so I want to self-direct. You would then request a service mix change in order to do that. Participants can also submit a verification request in the middle of the year. Maybe they were a participant who were flagged, but decided they didn't want to go through the process of figuring out, finding all the documentation. But in the middle of the year, they say, you know what, I actually really do want to go through that process. I think I need more budget dollars to account for my medical or behavioral needs. In the middle of the plan year, it's possible to request verification. Also, there are times when participants may want to change their plan of service in order to get a different support or change providers. If that's the case, then they'll need to submit a plan addendum, and they will get notices from the department approving or denying that requested plan addendum.
So we talked a little bit, Alina talked a little bit about the change in condition notices. So when an individual makes a request for a change in condition, so if you've had a significant change in your medical needs or your behavioral needs, and you think that it may impact the budget that you receive, you can let the department know about your change in condition, and the department will review that request and determine whether or not a new CISA is needed. So if your change of condition request is approved, you would get notice CIC 02. And if it is approved, we will say, we have approved it, and now we need you to complete a new CISA and a new Vineland so that we know exactly how much your change of condition has impacted your support needs. And so we let you know that we need that new CISA and Vineland. If, for whatever reason, you aren't able to complete that assessment, the individual will get a denial notice saying that we weren't able to, even though we have approved that you have a change of condition, we're not able to complete the assessments, and so we're not able to get you a new budget because we won't know your new support level. And so you will get notice CIC 04. If you get your new CISA and your Vineland 3 and it's completed, there's kind of 3 options for the types of budgets that you would receive once you have a completed new assessment. The options is that you could get a new budget, so your change of condition resulted in a different support level, and so you would get a new budget with a new notice with the new budget, and that would be CIC 05, and that would say, yes, we did your assessment, that has changed your support level, and here is your new budget and eligibility notice, and that new notice will be enclosed. If we do a new CISA and a Vineland and you have the same budget, then we just let you know that even though we did the new assessment, it didn't result in a change to your assigned budget level. And that could be, you'd get one notice if you did not request verification, that is the CIC 06, and you would get a different notice if you had the same budget but you went through verification. And again, that's so that the department can clearly let people know what the results of that verification process is. Also for the change in condition, aside from the approval, it may be that you get a letter that asks for more information, that is CIC 01, so that we can figure out whether or not an individual has a change in condition that could result in a need for a new assessment. Or you may get a denial, and that means that the department has reviewed the documentation you sent and it did not approve that change in condition, because we don't feel that the change in condition would result in a need to redo that assessment. We also have notices around service mix changes. When an individual requests a service mix change, as Elena mentioned, that could be that someone wants to maybe change from traditional to self-direct or self-direct to traditional. It could also mean someone is in traditional and they're receiving supported living services and they decide they want to switch to the certified family home. So if you want to make those residential changes or choose to direct your services through self-direction or through traditional, you would submit a service mix change request to the department, and there could be a few results from that service mix change request. It could be that the department needs more information to process your request, and you will get a notice that's titled SM01 for Service Mix 01. It may be that your request is denied. If your request is denied, you would get a Service Mix 04 notice. But the other option is if we don't need more information and you are approved, then we would look to whether or not you had a SIS-A completed. If your SIS-A has already been completed, you would get an approval notice, SM02, that would attach and include your new budget. If your SIS-A was not completed, we would say, we would let you know that in order to recalculate your budget, that we need to have that SIS-A completed, and we would send you a notice, SM03. And that notice would let you know the time frame that we needed to get the assessment completed. If you complete the assessment, you would go ahead and then get the approved SM02 notice. If the individual, for whatever reason, is unable to complete the assessment process, their service mix change request would be denied and they would receive letter SM05. Important to note here that service mix change requests are only denied if the request is incomplete or if the participant is not eligible for the requested service mixes. And there we go.
So we already talked about verification a little bit. I'll give you a little break, Karen. But as we also mentioned, participants can request verification at any time. If a request is made more than a few weeks after the assessment, then the Liberty assessor will ask if there has been a change in the participant's need. If there has been a change in the participant's need, then they will need to complete the change in condition process. If there was not a change in the participant's need and they just decided not to do the verification process at their initial assessment, then Liberty will send them a notice, which is called Verification 2, requesting that they submit that supporting documentation and the verification questionnaire. If the verification review team finds that they are eligible for levels M or B, they will get a notice with a new budget, Verification Notice 3. Then they'll need to develop a new service plan. If the verification review team finds the participant is not eligible for level M or B, they'll receive a notice telling them the decision, which is Verification Notice 4, but they can keep using their current service plan since their budget has not changed.
Okay.
So we just talked about a lot of notices. Would you like to, if you'd like to actually look at them, you can do so by going to My Choice Matters and clicking on the What's New tab. Once you get to the tab, there is a link for documents that were submitted that went up on Monday of this week called the Draft Budget Notices. Inside of that link, there are subfolders, and they're more or less divided in the different sections that we've talked about in this presentation today. In total, there are 48 draft notices that are divided across the following subfolders.
So they're divided into the annual budget notices, and those are the notices that individuals get if you've already been receiving services and you go in for your redetermination. They can be divided into the application and assessment notices, which again were those kind of notices about more information that we need to complete the application and assessment process. There are notices for change in condition notices. Again, if during the middle of the year you have a change in condition, it'll show all the notices that the department may send out related to your change in condition request. There are denial notices, again, if an individual applies for services, or if their redetermination determines that they are not eligible for services anymore. There are the examples of those denial notices. There are initial budget notices for new applicants that tell them their eligibility and their budget. There is a grouping of services for service mix change notices and a grouping of notices for the verification notices. So the department wants your feedback. I know there's been a lot of information that's been provided here today, but we really are looking for you to submit any suggestions, comments, or feedback regarding the draft notices by Wednesday, February 23rd, 2022 at 11:59 p.m. And you can send email comments to our mailbox at hcbswaivers@dhw.idaho.gov. You can leave a voicemail if you call the 1-800 number 855-249-5024 and leave us a message telling us about the notices, or you can send us a fax to 208-332-7286. Again, just remember that the information within these draft notices are subject to change. We're still awaiting feedback from CMS, and we're waiting for approvals from the legislature on our budget. And so things may still change, but we wanted to start giving you guys an idea of what all the notices look like. As we mentioned before, this presentation, the slide deck itself, will be uploaded to the My Choice Matters website. And we are also working on that recording, I believe. And so this slide deck, once it's updated or uploaded, you will be able to go back and look at the slides. So if you're wondering what notices relate to change in condition, you could go to those slides and see like which number of notice relates to kind of which circumstance, and that may help you kind of work through all the notices that were in the folders that we just showed you. But we really appreciate all your time here today. We are at 3:58 p.m. And so I think, Michael, do you have anything else you'd like to say? Or close us out here today?
I do not, just to say thank you for attending, and we will take the questions and comments that we've received here. They are being saved. We appreciate that, and as Karen indicated, we do want questions and comments through that hcbswaivers@dhw.idaho.gov email box as well. Thank you for your time, and Karen and Alina, thank you for your work on putting this presentation together.
Thank you, everyone.